Hi and welcome to EpMedic.Firstaid. My name is EpMac. On this channel, you are privileged to be equipped with theoretical and practical skills in basic life support in first aid. Without wasting much of the time, let's go straight to the topic in discussion, which is asphyxia, the inability or difficulty in breathing. What is asphyxia? Any cause which produces the stoppage of the exchange of gases in and out of the lungs immediately endangers life, especially the sick or the accident victims. And if this stoppage is prolonged, it causes death. Therefore, asphyxia may be defined as the condition in the respiratory system produced when the absorption of oxygen into the blood in the lungs is seriously interfered with or is altogether stopped. Our bodies need oxygen to function just like a car needs fuel to move. All our muscles, such as the heart, the biceps, the triceps, and all the systems of the body need oxygen in order for us to function. There is this feature that the heart may continue to beat for some time, probably 10 to 12 minutes after respiration has ceased. This makes it possible to restore such cases by performing what is known as artificial respiration. I shall do another video in which I'll talk about the types of artificial respiration and how they are performed. What are the causes of asphyxia? There are generally 4 causes of asphyxia, namely certain gases, electrical shock, mechanical obstruction, and poisons. Under certain gases, when gases are inhaled, they tend to block the walls in the lungs where gaseous exchange is supposed to take place. This is simply because gases are less dense or lighter than air. Electrical shock attacks the muscles of the chest and the respiratory system when electrons passes through one's body. There are so many objects under mechanical obstruction which can cause asphyxia, such as falling of the earth for those who work underground in the mines, falling of buildings where people are trapped inside, smothering. Now, like this can be seen in the case of a child playing maybe with a plastic carrier bag. Then he or she covers the head whilst playing around. When that oxygen is used up in that plastic, the child will eventually die. That's what smothering is. Then there's drowning, like in the waters, like in the swimming pool. Hanging, strangulation when the person has been strangled. This and many more things that may cause asphyxia. Under poisons, there are certain nerve poisons which can cause asphyxia when they attack the nerves. Snake bites, like that of a cobra, with venomous poisons which is able to attack the central nervous system and cause paralysis of muscles, including that of the chest and respiratory system, can cause asphyxia. Signs and symptoms of asphyxia. You can tell if the patient is suffering from asphyxia by observing the following signs and symptoms. Gasping for breath. These are deep and exaggerated attempts to breathe in the effort to get a breath. The patient may fall into convulsions. There is speed loss of consciousness. There is paralysis of muscles, and eventually the patient goes into unconsciousness. The pulse is full but low. There is no warm air coming from the mouth and the nose during expiration. There's no rising and falling of the chest during inspiration and expiration. Blood in arteries turn dark blue as seen in palms, on the face, the lips, and the tongue. However, with the first aider's quick response and taking advantage of the fact that the heart may continue to beat for some time, that is 10 to 12 minutes after respiration has ceased, it is usually possible to restore or resuscitate a patient by performing artificial respiration. Now, treatment. We are going to follow the standard sequence, which is DRABC or Dr. ABC. D stands for dangers. Send message or call the ambulance for help. Ensure the scene is safe for both you as well as the patient. Put on surgical gloves. R stands for response. Talk to the patient or arouse him or her to determine whether they are able to respond or the level of their consciousness. A stands for airways. Remove what is causing asphyxia. Tilt the head far back and lift the chin like that to extend the neck. Open the mouth to check if there is anything that is obstructing the airways. If the airways are clear, place the cervical collar to maintain the airways. B stands for breathing. Loosen tight clothing to expose and free the chest. Feel for warm air coming from the mouth and nose during expiration, whilst listen to breathing sounds. Simultaneously, observe the rising and falling of the chest during inspiration and expiration. C stands for circulation. Check the pulse at the radial artery or carotid artery. Findings. These would be our findings on the patient suffering from asphyxia. There is no warm air coming from the mouth and the nose. The chest is not rising and falling. The pulse is full but low. The face, the lips, the tongue, and the palms are dark blue. Diagnosis. Our patient is suffering from asphyxia. Action. Commence the artificial respiration using what is available. You can use mouth to mouth. You can use mouth to nose. You can even use an ambu bag if you have it around. Now I'm going to administer 15 breaths per minute, since the normal breathing rate is between 12 to 20 breaths per minute. I'm going to continue administering artificial respiration until I begin to notice the signs of recovery. With the continued administration of artificial respiration, I can see blueness fading away. I can feel the pulse beating stronger and stronger. I can hear the sobbing catch of breathing sounds during inspiration. Conclusion. The patient has started breathing. You have to check for further injuries. I'll check for other injuries starting from the head down to other parts of the body, checking for signs of bleeding, angulation, irregularity, shortening, and other signs. I'll continue monitoring the breathing of the patient as I check for signs and symptoms of shock. The skin is cold and clammy. The face, the lips, and the palms are pale. Therefore, my patient is also suffering from shock. Treatment of shock. Turn the patient into semi-prone position. Cover lightly with a shock blanket. Reassure the patient. Do not give anything by mouth. Continue monitoring the breathing of the patient until transport him to the hospital. Transport the patient on the stretcher. Report everything that you did on the patient to the doctor or the qualified medical personnel. This is where we end in this video. Join us in another video for some more